Hello, my name is Catherine Burke and I am a respiratory physiotherapist working in the HSE. In this education video, I am going to discuss the role of airway clearance for people living with chronic lung conditions. People with these lung conditions often experience breathlessness, cough, and have an increased amount of sputum, which may worsen during an acute flare-up. The sputum can often be difficult to clear, and airway clearance techniques can be used to help you clear this from your chest. The most commonly taught airway clearance technique is called the active cycle of breathing technique. Some of you may already be familiar with this. The active cycle of breathing technique aims to clear sputum in the easiest, most energy efficient manner and to prevent you from coughing excessively, which may cause airway irritation, fatigue, and muscle pain. The first thing you need to do is to become more aware of how you are breathing. Sit upright, place your hand on your tummy and one on your chest. Feel as your chest and tummy move as you take a breath in. Are you taking deep or shallow breaths? Are your shoulders relaxed or are they tensed up? Is your tummy rising as you take a breath in? Notice how fast you are breathing. Now that you are more aware of how you are breathing, we will go through the 3 steps involved in performing the active cycle of breathing technique. The first step we will talk through is called breathing control. I will explain how to do this first and then we can practice together. To complete this, place your hand on your tummy and keep your shoulders relaxed. Breathe in gently through the nose and out through the mouth. You should feel your tummy rise as you take a breath in. And take 3 to 4 gentle normal breaths in and out. Now we will practice together. Place your hand on your tummy. Take a gentle breath in through your nose and out through your mouth. In through your nose and out through your mouth. And in through your nose and out through your mouth. You can then move on to the second step, which is called deep breathing. Again, I will explain how to do this first and we can practice together. This involves placing your hands on your rib cage. Take a deep breath in through your nose. Aim to expand your rib cage outwards as you breathe in. Hold the breath for 2 to 3 seconds and breathe out gently. You can breathe out through pursed lips if you find it easier. That is holding your lips in a whistling position. So we will practice together now. Place your hands on your rib cage. Take a deep breath in through your nose. Hold your breath 1, 2, 3 and breathe out through your mouth. Deep breath in through your nose. Hold it 1, 2, 3 and breathe out through your mouth. And deep breath in through your nose. Hold it 1, 2, 3 and breathe out through your mouth. You can repeat breathing control and deep breathing exercises 1 to 2 more times as needed. For example, if you have more sputum to clear or if you are having difficulty clearing it. Then move on to the third step, which is the huffing technique. There are 2 types of huff, a short, quick huff and a long, slow huff. While doing this huffing technique, it is important to avoid wheezing or coughing. To use these, start by taking a medium breath in, blow the air out gently with an open mouth, as if you were fogging up a mirror or sighing loudly. You can use your hand to mimic a mirror and blow your breath onto it, as I will demonstrate. Follow this with breathing control and repeat the long huff if needed. As phlegm moves up towards the mouth, take a deep breath in and use the short, quick huff to move sputum high enough that you can cough it up. I will now demonstrate this. The active cycle breathing technique can be performed in upright sitting, lying, or postural drainage positions as instructed by your physiotherapist. When you are well, it is good practice to do airway clearance techniques once or twice daily, and when you are unwell, this can be increased to as many times as needed. If you are still having difficulty clearing your sputum, ask your GP or respiratory consultant for a referral to your local respiratory physiotherapist, as there are other airway clearance options available.
Hi, my name is Emer and I'm a HSE respiratory physiotherapist. I'm going to talk to you about coping with breathlessness. One of the most debilitating and frightening symptoms of a lung condition is breathlessness. It is important to remember you should not delay seeking medical help when you need it. However, you can learn to control this through breathing techniques and relaxation. There are 4 steps to use which will help you to cope with your breathlessness. The first step is to stop and think. If you get severely breathless when doing any of your daily activities, such as making the bed, climbing the stairs, going for a walk or going out in the cold air, stop for a rest. Step 2 is to get into a position you feel comfortable in, making sure that your arms are relaxed and supported. For example, leaning forward on a chair, or if in standing, leaning up against a wall, windowsill, or putting your hands on your belt or in your pockets. If your breathlessness is severe and likely to continue for some time, a more supported position would be best. For example, a raised lying position with multiple pillows so you're not lying flat, or leaning forward on a table with pillows under your head. Pacing is an important thing to remember, as it will help you manage daily tasks and reduce breathlessness. Once you feel comfortable in your chosen position and can keep your arms rested, you are ready for step 3, breathing control. Place your hands on your tummy and your chest. Concentrate on quietening your breathing by making it less effortful. Just let the air fall out. Otherwise, breathe out slowly for 4 to 6 seconds through pursed lips or lips held in a whistling position. Don't worry how fast you are breathing. This will settle as you work through the exercises. Avoid taking deep breaths in. Don't be tempted to gasp. Use your relaxed breathing technique, tummy rising and falling. Rest in your chosen position and wait until you begin to feel the relief as the work of breathing lessens and your breathing slows down. Finally, step 4, if needed, is to use your rescue inhalers or nebulizers. The most common rescue inhaler is the Ventolin inhaler. These steps are simple, but putting them into practice when you are breathless is not so easy. At first, practice when you are mildly breathless, so that you can concentrate on each step. Later, as you begin to experience the benefits and gain confidence, you will be able to use these techniques to cope during more severe attacks of breathlessness.